Hello, this is Dr. Do again. This video is on alphabetic list of problems. On letter K, I have mentioned I have had a couple videos about the kidney disease, and there's another important disease start with the letter K, which is the Kawasaki disease, which usually occurs in young children younger than 5 years old. It's a medium-sized vasculitis and treated with immunoglobulin or high-dose aspirin. I think I'm not going to talk about it because if you follow my other stream, I have talked about this Kawasaki disease. So that's all I can think, really, the diseases or conditions associated with this letter K. I think I'm going to move on to the diseases of lung diseases. So before I talk about the lung diseases and the lung structures, let me just bring up the first category, which is any conditions associated with lung disease requires emergency. Yes, you know it, a lot of it. Asthma, acute exacerbation, and also the pneumonia, severe pneumonia, particularly in those older people with other comorbidities, and also the injury, the acute, any kind of lung diseases like the cardiopulmonary cause the difficult breathing associated with heart failure. So a lot of conditions associated with this lung organ of lung or diseases require emergency visit. So what are the signs actually? There's the signs of lung disease warrant emergency. In addition to trauma, notable trauma or injury, high fever is one of the coughing, chest pain associated with the high fever, and cough up blood, of course, and also severe difficulty breathing and gasping for air, change color of the skin, especially the lips color changing blue, or for children, foreign body aspiration, of course, that definitely is emergency. So you, as a common sense, anything impaired oxygen transport or respiration really required, the sooner the better, see your doctor. Any diseases associated with lung that you can manage at home, pretty much if it is deep into the lung, usually it has to be managed by the physician. However, when we talk about the lung associated with the respiratory system, the upper respiratory tract infection, we all have it here or there once in a while, the common cold or just the viral cause upper respiratory tract infection. It can be managed at home, but when I talk about the lung and the lung diseases, it probably not include those categories. So anyway, so this is about the important information about this lung disease. Let me just talk about about the lung. You know it. Lung is the organ responsible for the oxygen inspiration and then undergoing the exchange carried by the red blood cells, and the oxygen can provide for our daily energy requirement, part of it. We have to have this oxygen, so the lung is so critical. So that's why the emergency situation associated with any kind of cause of lung disease, it's really just look for the signs, regardless of the cause. If gasping for air, difficulty breathing, fever with chest pain, go to the emergency, the sooner the better. So we have the two left or right and the right lung, and also in terms of the trachea, which is the passage of the air connecting the lung to the outside, to the upper respiratory system, divided into bronchi, and because the heart located on the left side, so lift up the left trachea is a little angle, is kind of right. So if you imagine, because the heart takes the space, so it's kind of the left trachea is a little right angle by the left broncho. The angle with the trachea is kind of quite right, near 90 degrees. But the right, however, the right side, the trachea became bronchi on the right side. It's kind of quite smooth, so that's why the foreign body, if you have children, if the foreign body you suspect might the children might accidentally swallow something or something get into the trachea, then you probably can, in addition to brought to the emergency room, you probably know just let you know that the right lung that's where the foreign body might tend to into the right lung. At the same time, also if patient lost consciousness and have aspiration to or drawing the water, so just in case sideway on the right side, so then the fluid can be drained out. Because of this angle, easy to drain. So this is the fundamental of the lung structure grossly. And in terms of the function unit of the lung are the alveoli. You already know it. The alveoli, just like the glomerula, it's the similar structure, but there is a membrane actually, and outside of this membrane, sac-like structure are the capillaries, wrap on the sac structure, so that the sac structure formed the membrane to pass oxygen, allow oxygen to pass to the blood, to the red blood cell, and also carry the carbon dioxide out to the air. So these alveoli are the major function unit of the lung. So then we already talked about this in terms of the gas exchange through this respiratory membrane called respiratory membrane formed by the different structures. I'm now going to talk about that. So let's just move on to the diseases of the lung diseases. First come to my mind, of course, pneumonia. There are different causes, different consequences of the pneumonia. Usually can be divided into viral or bacterial pneumonia. The viral cause of pneumonia could be serious in the young children when the pneumonia, the infection goes down to the end of the bronchi, to the bronchioles, which are the structure next to the alveoli. So if that's the case, it could be viral cause, but still could be very serious, so has to be managed in the hospital setting or sometimes even emergency, depends on the causes and the severity. And also for adult, also many virus can cause this pneumonia. Usually, if it is virus infection, could be cleared soon. Just the supportive manage, but may or may not have the fever. Of course, coughing, may or may not have chest pain. So that's the viral cause pneumonia. The bacteria, on the other hand, causing pneumonia could be very serious. Even though in young people can cause the lobar pneumonia, which is by the strep solidified of the special lobe of the lung, particular lobe. So that's the case. If that's the case, it has to be managed by the antibiotics, has to be diagnosed by the X-ray. Can see it. The very specific, very unique characteristic for this lobar pneumonia. And also there's some other kind of community-acquired pneumonia, which is quite common either in the hospital or outside the hospital. I'm going to talk about the community-acquired pneumonia next time and other lung diseases. So I'm going to stop here today, and thank you for watching. I will see you next time.